One of the things that I think we've improved upon in breast augmentation surgery has been the recovery process. If you ask 5, maybe 10 years ago, a patient who undergoes breast augmentation, one of the things that they will tell you is that it's very difficult, it's very painful, it's not worth it to go through the surgery. Not today. And I think part of the reason, as I mentioned earlier, is that we've improved the safety profile of the procedure, but that includes the post-operative management. Today, what we do is we manage the patient's pain situation really well. Pain is probably one of the biggest complaints that we hear from the surgery. But today, what we do is we give patients really good, strong pain medications. We also use pain pumps. In my practice, I use what's called an on-cue pain pump that stays in for about 2 to 3 days. And it helps manage their pain post-operatively. Occasionally, I'll inject pain medication directly into the breast pocket that gives them relief for about 2 days. It's not unusual today for me to do a breast augmentation at 8 o'clock in the morning, and that evening the patient is having dinner with her husband in a restaurant. Not because I did anything amazing, it's just that we've managed their post-operative pain really, really well. One of the other things that's very important is getting patients back to work. Before, it might have taken them 2 weeks, 3 weeks to recover from this. Today, maybe a long weekend, maybe 5, 6 days, so patients don't need to take as much time off from work and they can get back to work much faster. The first way that we've improved the scarring process is our incisions are smaller. If you asked me 5, 10 years ago how I was doing the surgery, we were making our incisions a little bit bigger than what we make them today. The way we insert the implants and we've changed that technology today. Without going into the nitty-gritty, but we use a special equipment to help us put the implant in. And essentially what that means is that it's limited my incision size. With limiting the incision size, that also improves the ability of that patient to scar really, really well. The smaller the incision, the better, the less noticeable the scar is. One of the concerns that a lot of women have from breast augmentation is that it's surgery. Oh my gosh, I'm having surgery to have something done. And the answer is that we've gotten better at delivering the care as it pertains to breast augmentation as a whole. And I think we've managed to eliminate some of that fear. Now, most patients who are normal get anxious, may not want this type of surgery, but most often that fear comes from the post-operative pain. How much time am I going to miss from work? Is this going to really put me out in my everyday life? How am I going to care for my kids afterwards? And the answer is that we've managed to shorten the post-operative period in the last, I would say, maybe 5 to 10 years. And I think we've eliminated, or at least attempted to eliminate, some of the fear factor that comes with breast augmentation. And I think that's partly why it's become the #1 cosmetic procedure.